Hello, my name is Annalie Martin, and today I will be talking about taking your pulse, the pulse oximeter, and also respirations. Okay, so with the pulse, you are going to want to be looking at the rate and the strength. If it was 0, it would be absent, 1+ would be weak, normal would be 2+, and bounding would be 3+. In an adult, it's usually about 60 to 100. And now with the radial pulse, you are going to want to take 2 fingers and on the patient and feel right at the wrist and lightly feel for that pulse. You would do that for 30 seconds and multiply that by 2. Now with the apical, that is the only one that you are always going to want to do 1 minute. You're going to want to do that whether it's regular or irregular, because with the radial, if it is irregular, then that's when you would do it for a minute. But the apical is always going to be 1 full minute. And the apical pulse is located right at the apex of your heart. It's medial to your mid-clavicular line at the 5th intercostal space. So you are going to want to feel that. Sometimes you may also want to auscultate that using your stethoscope as well. But you are going to be sure to feel that on the patient for 1 full minute. I found mine pretty easy. And with the popliteal, that is going to be behind the knee. So for that, you're going to want the patient to bend their knee, and that is going to be, you're going to stick your 2 fingers lightly right up there and be able to access that pulse that way. And then you also have your pedal, which is going to be at the top of your foot, and you're going to also again use your fingers to feel that for 30 seconds as well. With the pulse oximeter, so with that, you're going to use your index finger, your middle finger, or your ring finger. A normal reading for that is going to be 95 to 100. So you are going to want to make sure that their hands are clean, that they don't have nail polish on, and you're going to want to definitely take like an alcohol swab and just clean their hand and make sure that you clean the device as well. And so you're going to put that on their finger, set the alarm. And also before that, you're going to want to check their capillary refill before you put it on and make sure that it goes back to pink within 3 seconds. Some other options may be placing it on the patient's toes if that is better in that specific situation. So you will put that on, set the alarm, and then you will check to make sure that that is in fact at the rate that it is supposed to, that is at the oxygen saturation rate that it is supposed to be, which again is 95% to 100%. So with the respirations, you are typically going to want to do that right after you do the pulse and still keep your hand where it is, so that the patient isn't aware. You never want them to be aware that you are doing it, because then they tend to breathe differently when they are aware. I know, like when I go to the doctor, if they tell me that they're like checking my breathing, then I'm like, I'm kind of like breathing deeper and things like that. So you definitely don't want that. So you're going to just be counting. You're going to watch the patient's chest rise for 30 seconds. It's the same rule, and you'll multiply that by 2. It's the same rule as the pulse, in that if it is irregular or abnormal, it looks abnormal, you are definitely going to want to count that for the full minute. And if you cannot see them, if you can't see their chest and you're having trouble seeing them, just put your stethoscope on top, and I guess you probably could just still hold the pulse just so to keep them distracted, and hold that stethoscope, the bottom of it, on top of their chest, and just watch that rise, so then you can get a better visual of and get a better visual and be able to count how many times their chest is rising.